This is a discussion of end-of-life wishes for a patient. This is, in case you don't know or you're new to Periscope, this is Dr. Mark Vaughn of the Auburn Medical Group, and I'm here with a patient who has agreed to share this very personal discussion with the world in hopes that other people will take action and get their end-of-life wishes taken care of and down on black and white and paper, so that when the time comes that they can't make decisions for what level of care they want done, it's already taken care of because there's a form. Now in California, we have a form called the POLST form, this bright pink piece of paper. POLST stands for Physician Orders for Life-Sustaining Treatment. And the idea is that the patient would have this form, say on a refrigerator in their house, have a copy at their local hospital where they would go if they were to need to be taken to the hospital, that gives a very simple, really to the point description of what they would want done, in addition to having a full advance directive, and it asks if they have that, and having a healthcare agent. You always want to have someone designated to be your person, so you're not able to. It's always better to have a person than a piece of paper, because a piece of paper has to be interpreted, whereas a person knows the patient and knows what their wishes would be. This has 3 simple sections to it that we're going to go over. The first one being, do you want CPR or not? It has 2 categories here. One is attempt resuscitation, CPR, or do not attempt resuscitation, CPR. So this would be a situation where a person's heart is not beating, and clinically they are dead, and it's a matter of, do you want to be revived? And what would you want in that situation? Your heart wasn't, and we came across you, and the paramedics come up. Do you want them to start your heart back up?
You want me to answer these questions for you now?
Yeah.
I do not want.
You do not want that to be done. You've already gone, you want it? Okay. Then we'll go ahead and mark that. Oh, I can mark it for you.
Okay.
I just have to have my hand switched. Okay, so we're saying do not attempt it. And patients will answer this either way, and I'm okay with them answering it either way. I go with whatever they want. Now the next section, I'll put it down here and show it. The next section is, if in the situation you aren't able to answer, but you do have a heartbeat, would you want full treatment to be done with the primary goal of prolonging life by all medically effective means, in addition to treatment described in the lower sections? And so this can include advanced airway interventions, like putting a tube in your throat, mechanical ventilation that's being hooked up to a machine to breathe for you, and cardioversion, which can be shocking the heart with electricity. And then you can also mark for a trial period of full treatment. And that's not really defined as who decides what the trial would include. Now we were talking earlier, and from the way you were talking, it sounded like you would not want full treatment. Okay, so we won't mark that one. So we move down on the list to the next one, selective treatment. Selective treatment being the goal of treating medical conditions while avoiding burdensome measures. So this is what we're doing. In addition to just comfort care, it would also include some medical treatment like an IV or antibiotics, IV fluids, but not intubating, only using non-invasive airway measures. That'd be like a mask blowing air at you, but nothing going inside of you. And that's the one I often encourage someone in your situation to mark, where if your health could be improved with some interventions, go ahead and do some and see if I turn around. Right. Is that the one you would want?
That would be all right.
Okay, so we'll go ahead and mark that middle one. And then the lower one, comfort-focused treatment. Primary goal of maximizing comfort, to relieve the pain and suffering with medication by any route. That could include an IV. To use oxygen, suctioning, manual treatment of airway obstruction, but not using anything beyond that. Not using an ICU type treatment. Not intubating the patient. Not giving them antibiotics to treat an infection. That's really somebody who's in a hospice situation that we would mark that for. Okay, the next section, that's one of those 3 sections. The next one is, oh, somebody has a question here. What if an ambulance comes to the scene and doesn't know about this paper and they perform CPR? That's unavoidable. They would go ahead and perform CPR. A patient could always wear a medical alert brace that says no CPR, or do not intubate, or do not perform CPR, or DNR, do not resuscitate would be another way they call it.
So I assume this would, they would be called to my home, and the paper is on the refrigerator, and that's where the emergency people check first.
Yes, and somebody is saying that this is for hospital use only. It doesn't say that. It says healthcare providers. And healthcare providers can include providers in or out of the hospital. Now, its intent may have been just in the hospital, but it is being used in other settings. And that also may vary from state to state. Okay, so the next one about nutrition. Long-term artificial nutrition. This is feeding you through an IV. Or a trial period of artificial nutrition. Again, that could be either IV or a feeding tube going in your stomach. Or no artificial means of nutrition. So being fed through a tube.
Right.
My recommendation is to go with a trial period, because you can always stop it. You can always tell them after 2 weeks, stop. And so that's actually what I write in a lot of people's is 2 weeks over here in the additional orders. Or if you say, no tubes, I don't want to be tube fed at all, we'll just mark it as none. Or if you would want no limits on it, we'd say go ahead and tube feed all you want.
No, I am sure I would prefer no tubes.
No tube feeding at all, not even for a trial period. So we'll go ahead and mark that. Oh, and you can see people put on hearts when they like what's going on.
Oh.
So I just saw a heart.
Okay.
So somebody likes that we're doing this. The next one is the advanced directive. I'm sorry, that was the third one. Okay, so it went CPR, no CPR. Oh, here's the hearts. See all the hearts there? Somebody likes what we're doing. Somebody says, brave lady. They appreciate you sharing this.
Oh.
Okay, so the three sections are CPR, no CPR, full treatment or not, and then nutrition. And you have decided what you want. I've already signed it because I knew that we would get to the end of it. Your signature would go right there.
I do a full signature because I can't write that well.
Oh, just whatever. And then your legal signatures would be. I'm encouraging all of you, especially if you have a chronic health problem that makes you more likely to need end-of-life instructions to be given, to go ahead and give instructions through some kind of form like this or an advanced healthcare directive. Tell your loved ones what your wishes are so that if they go to the hospital and you're unconscious, they will know what to say on your behalf, and you've done that with your son and daughter.
Right.
A person is always more important than a piece of paper. To be there for a doctor to ask, what would your mother want, or loved one, whatever it is. Is she currently hospitalized, or is this a regular visit? This is actually a regular doctor visit. This is not, we don't expect something to happen. She does not have a health problem that makes us think that she's going to, in the next 6 months or year, have to put this into place, but we want to have it in place in case. Many people have seen loved ones go through an experience of having decisions made that weren't made in the patient's interest. They were made because they had to guess what they wanted. Is this about your ma? Somebody knows.
Oh.
Isn't that funny? They know about my mom because yeah. Yeah, I still need to talk to my mom about this again. She showed me hers. I have a copy of hers, and I intend to have yet another conversation with her. I will honor her wishes to not have anything done, but I will go over it again. I'll probably have her watch this. Okay, so what we'll do is stop this, and we'll start another Periscope about a shave biopsy on a patient that we've already spent some time with. So we'll come right back. We'll give it another title so that people who want to watch a procedure know that's what it is. Thanks for joining, and thanks for the hearts. If you don't already follow, swipe right to follow. We'll see you next time.